the power must overcome the resistance to complete pulmonary ventilation. What's the resistance to ventilation? What's the effect of surfactants? Why can patients feel easy after endotracheal intubation? With these questions, we'll learn the resistance to ventilation. The resistance includes elastic resistance, accounting for 70%, inelastic resistance, accounting for 30%. Elastic resistance is the ability of elastic structure to resist stretching or deforming. Both lungs and thorax are elastic structure, so have elastic resistance. The resistance of thorax depends on its location, maybe the power or resistance to ventilation. Elastic resistance of lungs comes from two aspects. One is elastic recur from the elastic fiber and the collagen fiber. The larger the expansion, the greater the elastic recur. The other is the surface tension at the liquid-air interface. Look at this picture. Expand the two lungs to the same volume. It's easy to expand the lung full of saline, but we should use 3 times force to expand the lung full of air. It's due to the surface tension. Surface tension accounts for 1/3 of the lung elastic resistance. Surface tension is the resistance to inspiration. From the law of Laplace, we can see that pressure in small alveolus is higher than that in large one. The pressure difference pushes air flows from small alveolus to large one, which resulting in the collapse of small alveoli, the expansion, even rupture of large alveoli. Surface tension can absorb fluid from blood vessels into the alveoli, causing pulmonary edema. This can't occur in normal person because there's a layer of surfactants at the surface of alveolar fluid. Surfactants is secreted by alveolar epithelial type II cells. It inserts in the liquid-air interface, can reduce the surface tension, beneficial for the inspiration. The density of surfactants varies with alveolar radius. In large alveolus, the density of surfactants is low, so the surface tension is high. In small alveolus, the density of surfactants is high, the surface tension is low. Therefore, the pressure in alveoli of different size is equal. So, air flows only between alveoli and atmosphere. Surface tension suction effect may lead to pulmonary edema. Surfactants can reduce surface tension, so prevent the edema. Patients suffer with pneumonia or thrombus may get pulmonary edema and atelectasis due to the decrease of surfactants. Surfactants isn't produced until pregnancy 25 to 30 weeks, to the highest in 40 weeks. Premature babies may get respiratory distress syndrome, even to death for the deficiency of surfactants. Inelastic resistance is airway resistance mainly. It's the friction between gas molecules and the wall of airways during ventilation. Factors affecting airway resistance include velocity, flowing pattern, and the radius of airway. If air flows fast, the flowing pattern is turbulent, or airway radius decreases, the airway resistance increases. The radius of airway is the most important factor because the resistance is inversely proportional to the force power of radius. With radius decreased half, the resistance will increase 16 times. Then ask you a question. Do you know airway resistance takes place in large airway or small airway? Which one? The answer is large airway. 90% of airway resistance occurs in airway with diameter more than 2 mm. 10% occurs in small one. Gas flowing in large airway such as nose, mouth, glottis, and bronchi is turbulent, while in small airway is laminar. And in large airway, gas flows fast. Therefore, airway resistance takes place mainly in large airway. Patients with dyspnea can feel easy after endotracheal intubation. Next, let's do a summary. The resistance to ventilation includes elastic resistance and inelastic resistance. Elastic resistance of lungs mainly comes from surface tension. Surfactant can reduce surface tension and plays a great role in normal breath. We should grasp the function of surfactant. The inelastic resistance is mainly airway resistance, which accounts for a small proportion, but is the main factor causing ventilation disorder clinically. That's all for this class. Thank you. See you.